Thinking about orthopedic surgery in Mexico City? You'd assume stricter rules make it safer.
Normal criteria is that patients with some weight above some index cannot do it. For me, it's helping the patient.
This surgeon says that's not always true and explains why.
My name is Harim Arias Gutierrez. I'm from Mexico City. I have the studies on Universidad Nacional Autónoma de Mexico. It's the best university here in Mexico. I did specialty of surgeon orthopedic in a public institution called Instituto Mexicano del Seguro Social. We always do a previous exam with an internist or cardiologist. We always send blood tests, electrocardiogram, chest x-ray. Normal criteria is that patients with some weight above some index cannot do it. For me, it's helping the patient, because there are a lot of doctors that say, no, you have to lose 50 pounds or 60 pounds so I can do the surgery. Okay, I understand why they do that, but we have to put us at that side of the table. Basically is that if the cardiologist say we have to see or give them treatment for another thing, well, okay, we can wait and then we will enter. If they can pass and the cardiologist and the internist say it's okay, he can do it, we do it. The two most important in hip replacement is when the hip goes off the acetabulum, the head of the knee goes up, and the second always is the infection. One of the important things of doing well in the surgery is that it doesn't happen. If they have another pathology, we have to treat it first. Diabetes, hypertension, or something like that. We have to control it first, and then we can do the surgery. That's very important. We have to check 2-3 weeks to see the incisions that doesn't have indication of any infection. The first day is the surgery, to stay calm, to stay in bed, and the next day we start with the walking with the physical therapist, 2 sessions of the physical therapy on the next day of the surgery, and the next day another one to have some confidence on the surgery. So I can see the patient in 2-3 weeks. When I can see the incision, it's already closed and we can take the stitches. But the critical phase on this is 2-3 weeks to prevent some infection, pain, prevent thrombolisms. It's important to tell the patient that if there is something wrong with the incision, they have to tell me. I have to be the first one to know. And the important is to come back to the hospital to treat them quickly. So we can take some tests from the incision, give them treatment with antibiotics or with another surgery, maybe like cleaning surgery. Then we can do it fast to keep the knee replacement.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.